QFIRST, Quality Focused Interventions for the Relief of Symptoms team, is an innovative approach to the planning and care of high-risk surgery patients, developed on the Sunshine Coast, Queensland, to empower both patients and healthcare providers to choose wisely. Through the QFIRST pathway, we wanted to address problems faced by high-risk surgery patients, defined by age, frailty, comorbidities, or calculated risk. The precarious balance between risks and benefits in this group was highlighted by a statewide review, where 496 of the first 800 perioperative deaths were classified as inevitable, and questioned the benefit of pursuing surgery in some of these patients. This issue demonstrates the tensions that exist by balancing the growing burden of healthcare costs, increased surgical and patient complexity, and the growing demand for patient autonomy and shared decision-making. Despite accounting for only a minority of procedures, high-risk patients account for 80% of surgical deaths. The QFIRST pathway reinforces shared decision-making and facilitates a coordinated, patient-centered approach to determining goals of care. This has been achieved by creating the QFIRST nurse position, and then the QFIRST nurse meeting with the high-risk patient and asking them what matters to them in order to determine their values, goals of care, and acceptable compromises. And then using this information, coordinating a multidisciplinary team meeting led by a perioperative physician with a roundtable discussion from a variety of perspectives framed in the context of the patient's goals of care. And finally, but most critical, the QFIRST nurse is a focal point of contact and advocacy for the patient throughout their hospital journey, following up regardless of whether the patient opts for surgical or non-surgical management. The QFIRST pilot ran over 9 months, during which 50% of patients were referred. As can be seen, excellent outcomes were achieved in this high-risk group, with 70% of patients agreeing to surgical management, yet having less complications and returns to theatre when compared to high-risk patients that did not participate in QFIRST. We also found sustained improvement disability scores at 90 days for our patients that elected for surgical and non-surgical management. But more importantly, by matching what matters to our patients with what we can achieve, QFIRST has successfully implemented to support shared decision-making and has helped us and our patients choose wisely when considering high-risk surgery. What we have achieved is best highlighted by what our patients have to say of the QFIRST pathway.